So I've aspired to be many things in my life. A hospital doctor, a vet working with wild animals, wild cats, a historian, a scientist searching for answers to all of the questions about our planet, even a professional food taster. But one thing I've never really aspired to be is a leader. I've never really seen myself as someone who should be leading change. And that's an honest statement. But this becomes even more compelling when you consider what I actually do in the world. So I work to support many people across the Global South in particular. I work to support grassroots organizations. So we're talking about trade unions, we're talking about worker cooperatives, we're talking about worker associations, we're talking about activist groups. And I see myself as doing what I call solidarity work. So in supporting these organizations, I co-construct public health research, advocacy, movement building projects in support of their work on economic justice and health justice. That's what I do in the world. Now, all of this is to support them. They are the world's most exploited and marginalized workers. They are called workers in the informal economy. There are more than 2 billion of them, and they make up the majority of the world's workers. In fact, they make up almost 2/3 of all of the workers on our entire planet. Now, for those who don't know, these workers are all around us. You've probably seen them in the time that you've been here in Ethiopia. Think about the domestic workers cleaning, cooking, caring for children, caring for the elderly, caring for sick, unwell people in private homes, working 24-hour shifts without a break. Think about people who work and live in the world's landfills, sorting through what we see as trash or rubbish, and managing that waste and facing a whole array of risks. And you can even think about the women just around the corner from this building on the side of the street, selling crisps, selling biscuits, having no access to primary health care for themselves, as well as for their children that they have to bring with them to the marketplace. These are workers in the informal economy. So when it comes to speaking about my aspirations or lack thereof for leadership, it's really about thinking about who should be leading that change. Should it really just be you, the Westerner sitting in the global north who's had access to privileged education? Or should you actually pass on some of that ownership to the people whose lives are shaped by these struggles? We know only too well that within global public health and in so many other areas of governance, this top-down approach is what prevails. And there's no space for worker participation, worker voice, any of these things. This is incompatible with how we should be viewing the world. And I know very well that if I'm doing the solidarity work that I claim to be doing, then this should never overshadow what I would say is the real work that's happening on the ground. So when I revisited my aspirations for this, I realized that my perspective on leadership was actually pretty short-sighted, narrow, and one-dimensional, quite frankly. I realized pretty early on in this fellowship, that actually leadership isn't necessarily a role, a defined role. It is rather a practice, and anyone could be a leader within the boundaries of their work. And so even if I never actually aspired to be a leader myself, and I found it really hard to contend with this notion of being a leader and leading change per se, I could still embrace leadership and embody leadership in what I do. And all of this is to try and shift power and resources away from us in the global north to those in the global south who are living through these struggles every single day. And quite frankly, are better leaders than I think I ever could be. So my ethos was therefore to step into leadership by nurturing leadership in others, and then stepping aside and creating space for them to grow. So working at my organization, which by many metrics is quite an atypical organization, as a research policy action network, we adopt a subversive bottom-up approach to supporting workers. So we see workers as a super marginalized and exploited group, but we never claim to speak on their behalf, and we never want to. So my health equity project aimed to identify health leaders on the ground, grassroots health leaders who are doing all the important work. So examples of that could be domestic workers fighting for access to COVID-19 vaccinations in Malaysia, or waste pickers in Ghana fighting for access to toilets and sanitation and clean water. So I've been working with trade unions, worker cooperatives, associations, activist groups in order to facilitate a range of online consultations with workers all across the globe to really try and understand what's happening on the ground, who's doing the work, and under what conditions. And this was really part of a larger organizational exercise where we tried to plan our actions and our strategies around supporting workers in the informal economy, and doing this in a participatory way where we co-construct an action plan on what we're going to do. And so in doing this, I worked with multiple people across our very wide network, which in itself includes many different organizations. I worked with people, regional organizers who have very direct, deep, and trusting relationships with grassroots worker leaders. And all of this was really pivotal to securing the participation of workers at these consultations. And in the end, we actually managed to involve 200 workers from a whole range of occupations, different countries, with different backgrounds, living in 5 continents. So one thing that I wanted to highlight was the importance of mapping actors. This was a really key thing as part of my health equity project. We sought to understand we sought to understand the ecosystem and to see who is doing what. And this really helped to cement and clarify and lean into all of these shared assets, shared interests, here being improving working conditions of workers and actually securing their human right to health. And I found that this was a really important exercise for kind of locating us in this entire ecosystem, and that was also very helpful for our strategy. And I found that uniting people around a shared goal, and reiterating the fact that we together would, build this plan of action together, not me dictating to trade unions what I think they should be doing, but really us sitting down and making decisions together and understanding priorities. All of this was so important, and of course, all of this was only made possible through building new relationships, a whole array of new relationships, but also developing and deepening existing ones. And all of this, of course, was underlined by trust. But engaging in this process can never be without challenges. And when you face challenge, there always comes a choice, right? So the work to identify these worker leaders is long-term. It's, in a way, it's never-ending. It's undetermined. And the challenges that you face don't just disappear. They never go away. And often, they're not conclusively resolved. And that's something that I learned in this process. So for example, I found that the sheer number of logistical challenges with engaging with people from Chile, Colombia, in the time zone that's 8 hours behind me, while simultaneously engaging with people in Malaysia and Thailand and China, was a huge issue. But unfortunately, this is part and parcel of doing global work. It's something you just have to cope with. And you just have to do what's fair for everybody and do it as best you can. I also found that, my role being in the global north, sitting in the global north, and having this very imbalanced relationship with workers was also very challenging for me. It really reinforced the same inequities that I'm trying to fight. And it also showed and demonstrated to me the limits of my own power to change that. And that's difficult. I also found that the best way of trying to do something about that was to make this process as participatory and as open as possible. That is the best that I could do. And I feel, at the same time, that we were successful with that. Just creating the space for workers to share their experiences, tell us their priorities, tell us what's happening in their locations, and tell us what they think we should do about it. And another struggle that I found is that I really struggle with delegation. I really struggle with identifying things that someone else should help me with and identifying the person who's best suited to do that. That's just an eternal struggle for me. And so it forced me, being in this process, forced me to put trust in the knowledge and expertise of all of those regional organizers who have these deep relationships with these workers. And I relied so much on these regional organizers for this. And they were so pivotal to securing access and the participation of these workers in these consultations. Now, as a result, we now know so much more about what's happening with regards to workers taking action on their issues around access to healthcare and occupational health and safety. We know who's doing the work, we know where it's happening, and we know under what conditions that work is happening as well. We have so much more understanding of the layout of all of this work. And also of the levels of support and resources that these leaders will need to strengthen their own leadership. And that was really important to me, and I'm quite proud of that. I also want to share that following this project, with the identification of all of these leaders, these fantastic, inspirational leaders, it's now going to create a pool of leaders. We're going to call them champions. And these leaders will be nurtured and supported. They will tell us how we can nurture them, how we can support them, what they need from us. And this will be a long-term exercise. So if they need training on a specific thing, communications, or training on the policy ideas that are relevant to them, we will provide that for them. So that's a real success story that's come out of this. And aside from this, I think it's really important to note that this process allows these workers to have more ownership of our organization, not just this project, but our organization. And it makes us more accountable to them. And I feel that's really important in terms of sharing power. So this project has really been quite a journey for me. Again, many challenges, many choices, but has had some success, and I'm really proud of that. I never aspired to be a leader, as I told you at the beginning, and yet I face a paradox. In order to step up and be a leader and own my responsibilities to my network and all these workers that I care about, I really feel the need to step aside, nurture their leadership in the long term, and in doing that, I've had to become a leader myself in many ways. So maybe, just maybe, this is just part of what it means to do solidarity work. Thank you.